When was the last time that you went to the emergency room? Were you having a life-threatening emergency? Or were you going to get a doctor's opinion or a school or work excuse? Are you aware of how often the emergency room is misused, causing increased taxes, longer wait times, and quality of care a person receives? Emergency room misuse is preventable, and some states have implemented technology programs to help cut down on misuse, including those who use various healthcare facilities for narcotic shopping. One way Washington is cutting down on this is through a program called EDI. This stands for Emergency Department Information Exchange. This program sends out a notification on a person if they have had more than a certain amount of visits in the emergency rooms and other healthcare facilities within an allotted amount of time. It also details narcotics prescribed and how many were prescribed. This helps departments avoid prescribing said narcotics to people who are abusing them. Another problem that has arisen over the years is the lack of mental health facilities and treatment centers. This has caused an increase in emergency room use for the chronic illness. All of this leads to the fact that emergency misuse is on the rise regardless of age or insurance coverage for the citizens across our nation. According to healthcareskills.com, a 2010 study by the RAND Corporation indicated that unnecessary ER visits cost the United States healthcare system $4.4 billion annually. Take a minute to think about this. A study 10 years ago, and that amount has only risen. In the article, Why Americans Paying More for Healthcare? Peter G. Peterson Foundation, the author writes, in 2018, the United States spent about $3.6 trillion on healthcare, which averages to about $11,000 per person. Relative to the size of the economy, healthcare costs have increased over the past few decades, from 5% of gross domestic product in 1960 to 18% in 2018. The Center for Medicare and Medicaid Services project that by 2028, such costs will climb to $6.2 trillion, or about $18,000 per person. That is a lot of money per person. This comes down to what taxes a person must pay. The amount is high because many choose the emergency room department as means of care that they can't receive in a medical clinic for lower costs, knowing that the emergency room may not have to pay higher bill of the emergency room visit. Because of these unpaid medical bills, hospitals must increase the price for everyone to make up for it. Often, emergency room wait times to be seen can be 2 or more hours. Nurses triage patients according to the severity of their visit. It is a normal thing to be waiting for a long period of time. While someone who comes in after that said person might go back. This is due to their medical problem being significantly more life-threatening than that of the person who has been waiting for a long time. Another more recent reason for a person to go back to a patient room quickly is for isolation precautions. This person might be highly contagious, suicidal, or a danger to others. The last two require one-to-one person watch for safety reasons. From my experience working in critical care units, emergency room, and on a local ambulance, a long wait time does not mean that your medical need is unprecedented, but instead that you are not being seen for something that is currently life-threatening. I hope that everyone who waits a long period of time to be seen realizes that a longer wait time to be seen means a good thing. Now, I'm not saying that all wait times will be long. Emergency misuse happens all the time, any time of day, used at the convenience of the citizens rather than the emergent need. There is a lack of available scheduling at most medical clinics. This is due to a lack of physicians, nurse practitioners, and other healthcare experts. There are more telehealth clinics being created for the public, but this is new, and most people feel that the care is not personal to their needs. Another problem that arises with citizens not using the medical clinic or urgent care centers is that the hours that they are open. The limited hours can create and cause a person to miss work, and they may not have the ability to miss work. This is a large reason for a surge of patients seen in the emergency room in the evenings, often for routine care that has been put off by not being seen by a primary care physician. When emergency rooms are overrun with non-emergent patients, the quality of care received is often less personal than a person would receive in a medical care clinic. Less time will be spent with the healthcare provider in an emergency room. The healthcare providers are having to focus their care on multiple people at once, lowering the level of care of the non-emergent patient. Focus will be on more life-threatening situations, like patients that are being seen for strokes, heart attacks, cardiac arrests, or injuries that can be life-threatening. Security guards in hospitals will often be seen sitting at the entrance of the patient rooms, providing patient watches so that healthcare providers can provide care for ill patients instead of keeping watch over patients that may be a danger to themselves or others. These patients require constant and continuous monitoring and documentation of what they are doing in the room. When there are not enough security guards to cover these watches, other core staff will be pulled from providing patient care to sit at these watches. These patients are often mental health patients who are repeated users of emergency rooms. This has become a problem for emergency rooms due to the lack of mental health care facilities and treatment centers. Hospitals cannot force a patient to stay in the hospital even if they are having a psychiatric issue or if they are under the influence of intoxicants. The most they can do if a patient decides to leave is call the police if they deem the patient is a danger to themselves or others. As more people flock to the emergency rooms for non-emergent care, emergency room misuse will continue to rise. Communities need to raise awareness through educating the public about what is considered a medical problem for emergency rooms, or what they could use an urgent care clinic or a medical clinic for. As primary care providers need to encourage the use of telecare health and teach their patients about how to and what to use it for. Also, these providers should always let their patients know that they have after-hours practitioner on call to answer questions. Clinics could expand their hours or have urgent care clinics with alternating hours, such as open during the day, evening and night hours, to help reduce the number of patrons using the emergency room for minor illnesses. Doing this would facilitate a better quality of care for patients and help to reduce the medical costs for all. If our nation can do even a few of these things, it will lower the number of patients misusing the emergency room.